is the reading of the minutes of the meeting held on August 26, 2021. The members were provided with the draft of the minutes of the meeting through your emails. Is there any motion to
Mr. Chair,
yes, yes, sir.
I move that we dispense with the reading of the minutes, and I further move that the same be approved.
I second.
Is there any second to the motion?
Second the motion, Mr. Chair.
Thank you, Representative Evgas. There is a motion from Representative Angelo Barba to dispense with the reading of the minutes and for it to be approved. Is there being no objection, the motion is carried. Good afternoon to our members and to our resource persons, invited guests, to our viewers via Facebook of the House of Representatives. Thank you for your support and attendance. We welcome everyone to the second hearing on House Resolution number 1769 and 1770, filed by Honorable Stella Kimbo, and House Resolution 1964, filed by Honorable Maria Luisa Quaresma, on the unpaid claims involving PhilHealth and the state of social health insurance programs in the Philippines. Our first hearing was held last week, and we thank our honorable members and our esteemed resource persons for the meaningful discussion. Since then, PhilHealth stopped the implementation of its circular number 2021-0013, which suspended payment against healthcare providers and claims under investigation for fraud, unethical acts, and abuse of authority. The stoppage of this circular thereby allows payment of claims that shall redound to the benefit of the hospitals nationwide. We thank PhilHealth President and CEO Attorney Dante Geran, the officials of PhilHealth for this development, and for their candor and honesty during our first hearing last week. We likewise commend the Philippine Hospital Association President Dr. Jaime Almora for sharing his sincere sentiments as the representative of the private sector that reveal his true compassion for the Filipino people. As for our public servants, I thank our members who interpolated and contributed in threshing out the issues on hand, particularly Representative Stella Kimbo, Honorable Hector Sanchez, Honorable Marvy Marino, and Honorable Sharon Garin, as well as our resource persons, Secretary Jeremiah Belhica. With their questioning and comments, this committee unraveled important circumstances such as the amount and aging of unpaid claims and turnaround time in claims processing by PhilHealth, which have yet to be verified. These details shall go into this committee's determination of the existence of malfeasance, misfeasance, or nonfeasance committed by public officials. For today's hearing, we expect an explanation from PhilHealth, including a discussion on audit findings and actuarial projections that shall depict the state of public health insurance in the Philippines. On that note, let me strongly remind our attendees na tama na po ang drama. The Philippines is still in a pandemic. We need to focus and act swiftly because around 200 people die every day and around 20,000 get infected with COVID-19 daily. We need PhilHealth to be focused and ready to deliver. As I have said before, the House Blue Ribbon Committee is not about personalities, but on finding solutions to be efficient and effective for the people. Once again, thank you for attending today's hearing that is be guided by our mandate to help and serve our countrymen to the best of our abilities. Good afternoon and God bless us all. Salamat po. May I now direct the committee secretary to inform the committee of the attendance of our members in today's hearing.
Good afternoon, Mr. Chairman, and to our members and guests. We have the following members in attendance via Zoom. Representative Alan Duhali. We also have Deputy Speaker Rosemary Baby Arenas, Representative Siriaco Gato Jr., Representative Adriano Ebcas, Representative Angelo Barba, and Deputy Minority Leader Stella Kimbo.
Thank you, Comsec. And now direct Attorney Marivic to inform this committee who are the resource persons present in today's meeting.
Thank you, Mr. Chairman. From PhilHealth, we have the President and CEO, Attorney Dante Heran. We also have SVP Attorney Jose Marie Tolentino, AVP Walter Bacaresa, Dr. Lambert David, Dr. Benjamin Page, and VP Ann San Andres. For COA, we have invited the chairperson, Attorney Michael Aguinaldo, and COA is represented by the Acting Supervising Auditor for PhilHealth Audit Group, Attorney Abdul Nasif Faisal, Ms. Norma Belia Portillas, the Audit Team Leader for the PhilHealth Audit Group. We also have Attorney Ridgway Marabe, the Acting Division Chief of the Legal Affairs Office, and Attorney Gloria Camora, the Assistant Division Chief of the Legal Service Sector. From the Philippine Hospital Association, we already have in attendance the President, Dr. Jaime Almora. From the Philippine Private Hospital Association of the Philippines, we have the President, Dr. Jose Rene De Grano, and he is accompanied by Director Dr. Arturo Flores. Your Honors.
Thank you, Comsec. We will now give the floor to the sponsor of the House Resolution to tackle House Resolution 1769, which is on the non-payment of the claims of healthcare facilities. And secondly, which was not tackled at all last hearing, is House Resolution 1770 on the status of the social health insurance programs and the audit findings and actuarial projections. So Representative Stella Kimbo, you have the floor, ma'am. Good afternoon.
Good afternoon, Chair. Good afternoon sa ating mga kasama and resource persons. Una sa lahat, nagpapasalamat po ako, Mr. Chair, for taking up these two resolutions. And nagpapasalamat din po ako sa ating mga resource persons, particularly ang PhilHealth, na nakapagbigay naman po ng data sa ating tanggapan. So thank you very much po. So again, the two resolutions that I filed, the first one is on the it's an inquiry into the non-payment by PhilHealth of claims by hospitals. And natalakay na natin po yun in the last hearing. Lumalabas po na mukhang meron talagang 60 days na dapat maximum number of days for processing the claims. Siguro yan ang pwede natin ma-discuss pa further in a bit. The second resolution is about a special provision that is included in the 2021 GAA. And this special provision requires the PhilHealth to submit, first of all, a management audit. Kasi kung natatandaan po natin, Mr. Chair, last year, as a result of congressional as well as investigations by the Senate, nagkaroon ng management vacuum, no? Maraming na-suspend, maraming nag-early retirement. So we were worried na baka magkaroon ng issue pagdating sa management. And so we required a management audit by the PhilHealth. And then number two, again, because of statements by PhilHealth last year na tila limitado na ang buhay ng programa, tayo po ay nag-worry tungkol sa fund viability, and so Congress required PhilHealth to submit a fund viability plan, And in relation to this, also an undertaking or an agreement by PhilHealth to engage a third party to audit their actuarial projections. So maganda na at this point in time, malaman po ang status ng compliance ng PhilHealth patungkol dito, lalong-lalo na po na patapos na ang taon. And so yun po ang tungkol sa aking resolutions, and handa po ako mag-participate later on, Mr. Chair. Thank you.
Thank you, Representative Kimbo. Maybe we give the floor to the President for his opening statement, President of PhilHealth, Attorney Dante Giran, sir.
Mr. Chairman, for the opening statement, Mr. Chair, at the moment this presentation has no more opening statement because the opening statement was already made in our first hearing, Mr. Chairman.
How about po yung the main focus of the first hearing was the non-payment of the claims of hospitals. Do you have any opening statement on the status of the social social programs of PhilHealth and the actuarial projections and the compliance with the audit findings on PhilHealth, because this is a totally separate issue from the one discussed on the first hearing, sir.
For the unpaid claims, Mr. Chair, if the Honorable Chairman would permit us, we will present Dr. Jonathan Ely on that matter, Mr. Chairman.
Is this in accordance with what we requested last meeting? The briefing on the audit findings and the actuarial projections on the status of the reserves of PhilHealth. Will this briefing answer that, sir?
Mr. Chair, on the actuarial matter, we already submitted our position paper on the matter, Mr. Chair.
Okay. Okay, please proceed.
If you please, Mr. Chairman, we will, Dr. Jonathan Ely will make a presentation.
Okay, Dr. Jonathan, please proceed.
Yung position paper na nilagay ko sa
August 24, 2020. Out of the total received claims, 20,535,681 with an amount of 117.2 billion. 88% of the received claims have been processed. 78% were paid in the amount of 132.6 billion, with claims count 14,830,063. 6% were returned to hospital, amounting to 10.4 billion, and 4% were denied, amounting to 6.2 billion. The 12% of the total claims received were during August 24 were still unprocessed, with amounting to 21.1 billion, 3,532,884 claims. For claims received on 2022, PhilHealth has already processed 97.8% of the claims, with 88.8% paid, amounting to 92.8 billion. On August 24, 2.2% of claims were in process, amounting to 1.5 billion. For the total of 2021 claims received, 62.2% were processed, with 51.7% paid, amounting to 39.7 billion. And as of August 24, 2021 received claims, 35.8% were still in process, amounting to 19.7 billion. For the 97.8% claims process in 2020, 4.4% were denied and 4.6% were returned to hospital. And for the claims received from January 1 to August 24, 2021, out of the 64.2% claims process, 1.9% were denied and 10.3% were returned to the hospital. Okay, this slide shows the distribution of claims in process with aging by region based on count and amount for claims received and refiled from January 1, 2020 to August 24, 2021. There were 3,532,884 claims in process with an amount of 21.14 billion. Claims with less than 60 days were amounting to 10.69 billion, and claims with more than 60 days amounted to 10.46 billion. This is the same figure, but as a nationwide data. Okay. Out of the 100% claims in process, based on total amount, 46.6% belong to government facilities, and approximately 54.4% belong to private facilities. Based on claims count, 55% of the claims are from the government facilities and 45% from private facilities. Of the total in process claims, 19.7% were COVID-related claims and 80.3% were non-COVID related claims. This is the common reasons for claims aging beyond 60 days. So it's arranged based on the percentage. So there were no value has been set for patient priority subgroup. So COVID lab test claims should have, there should be an indicated subgroup to which the population belongs, because PhilHealth only covers the subgroups that were written in the DOH department. And second was no value has been set for services covered in COVID testing. So as we all know that based on the services and based on if the COVID testing kits were donated or were provided by the facility, the rate or the amount of the packet range there's a corresponding package rate. So if all the services and the test kits were provided by the facility, this costs 3,409. If the test kits were donated, 2,000, and if only services were done, it's 900. So it is very important for that the facility should indicate. The next is without attached valid itemized billing. All COVID packages, there is a minimum requirement which includes the itemized billing, which unfortunately the facility wasn't able to submit to PhilHealth. The next is no value has been set per flag indicating whether the test kits have been donated or not. So without attached valid case investigation form, so all claims, COVID claims, especially for laboratory, there should be a CIF attached where the facility failed to provide. Next is without attached valid SARS-CoV claim summary form. So this is also the facility also failed to submit this. Next is required document is unavailable, incomplete, inconsistent, unreadable. So the claims were also hold in process. Next is filed beyond 120 days statutory period. So this covers claims such as the hemodialysis claims for 2020 because pre-pandemic hemodialysis patients were only given 90 days. But for 2020, it was extended to 91 to 144 maximum days of hemodialysis. But the circular of PhilHealth was published on May 2021. So claims received last year were just processed by May. The next is no applicable entry found in the benefit library. And next is there's a double filing or same-day confinement, which the claims were forwarded to legal for possible fraud. Next. Okay, so top cases in process claims aging beyond 90 days. So this is based on the illness code. So what are the cases or illnesses of the patient? So the highest is the C19T1, which is for testing. So all services and supplies for the testing are provided by the testing laboratory. So as mentioned, next is the hemodialysis procedure. Next is test kits or COVID lab, which also relies on the table that was shown previously, which is it needs the checking of the subgroup of the patient and attachment of the CIF form or the CSF, as well as the next, which is test kits are donated to the testing laboratory, cost of running the laboratory and the RT-PCR machine for testing are subsidized by the government. The next is the expanded newborn care package. So the facility failed to submit the blue form or the newborn hearing test. So that's why the claims are being put on hold. So that's why they're still in process. Then routine obstetric care, including antepartum, vaginal delivery, and postpartum care. The next is chemotherapy administration because the maximum days pre-pandemic was 45 days, but there's still ongoing decision regarding extending 45 days for chemotherapy administration. And the last two is the moderate pneumonia COVID-19 and pneumonia moderate risk. These claims have to undergo the medical prepayment review prior to payment. Yes. So these are the top reasons why claims are returned to the facility. So the first is required document is unavailable, incomplete, inconsistent. There's discrepancy in the documents that were were submitted. There were errors encountered in the CFR XML for referral to service provider to fix the refile. There were lacking claim forms. Original PhilHealth claim form 2 not properly accomplished. The medical evaluators needs additional medical documents, so required medical document. No value has been set for the patient priority subgroup, so which is subgroup A to letter J at present. There were no attached itemized billing, and there were no attached claim summary form, and there is a problem, no electronic CFR data attached to the claim. So all of these claims were returned to the hospital for completion. So these are the major reason for the denials of claims. Pre-pandemic, facilities were given 6 days to submit the claims. Starting 2020 until present, they were extended to file within 120 days, but unfortunately, the facility still failed to comply. The second is case not compensable. Third is denied due to non-compliance. So the facility, these were claims that were returned to the hospital for additional documents or for compliance, but during refile, those documents were still not present. Next is late refiling, which is claims that were returned to the hospital. They were given from the 60 days, they were given to 120 days to comply, but unfortunately, they failed. Non-compliance to standard of care, length of service requirement not met, confinement not within the hospital accreditation period. There's discrepancies in the documents. Required document is unavailable, incomplete, inconsistent, unreadable, and required forms were still not present.
Thank you.
Sir, last 3 more slides, sir. So monthly average paid claims at present is 8 billion pesos. Weekly average paid claims is 2 billion pesos. So this was the historical turnaround time of claims paid, sir. So 2016, 39 days, 2017, 58 days, 2018, 46 days, 2019, 19 days, 2020, 42 days, 2021, 42 days. Sir, there's based on the average daily received claims, during 2020, PhilHealth only received 13,991 claims. But during at present, sir, 2021, PhilHealth now receives 39,103 claims. So there's an increase of 9,000 claims per day. Next page, please. So this slide is turnaround time per growth. So maraming salamat po. Thank you.
Thank you, Dr. Jonathan. One question before we proceed to the interpellators. Dr. Jonathan, how many percent are the claims above 60 days? How many percent of the pending? Or no, not pending. Yes, pending. How many claims are above 60 days?
Sir, there's approximately, for claims count, sir, above 60 days, that's 52.3%. But per amount, it's 49.5% of the 21 billion.
Okay, just a reminder, that is the focus of our investigation. Those above 60 days, which is granted to you by your charter, should be given attention, because that may be a violation already of law, the law that governs PhilHealth. So that's all. And before we continue, I'd like to recognize the members who went in just now. Representative Marby Marino, Representative Sara Jane Ilago, Representative Ferdinand Gaite, Representative Ron Salo, Representative Franz Castro, and Senior Vice Chair Boying Remulla. To interpolate first is the sponsor, Representative Stella Kimbo. You have the floor, ma'am.
Thank you, Mr. Chair. I'd like to ask Attorney Yaran. Attorney Yaran, ano po ba talaga ang purpose ng claims processing? Is it for fraud detection? Yun po ba ang, like when you orient your claims officers, ano ang sinasabi ninyong pinaka-objective ng claims processing unit?
Mr. Chairman, with respect to the question of Madam Congressman Stella, to be candid about it, I haven't met our face-to-face our processors. Of course, I gave instructions to our senior officers, and these instructions are being cascaded to what we call this, to this our people on the ground, on the regions. And with respect to the question about what's the purpose of processing, basically processing is basically a stage where claims are being evaluated, so that if the claims submitted are in accordance with our policy and existing audit procedure, then payment would have been made on those claims.
So, Mr. Chair, so ultimately, kaya nyo pinaprocess, tinitingnan na mabuti, is ayaw nyong madaya kayo. Tama naman, di ba? So it's really related to fraud.
Mr. Chair, I would say it's not basically ayaw madaya. Siguro let's talk this matter on the positive side of things. Maybe we are doing that to protect our funds, because we have fiduciary obligation to protect the funds of the government.
Okay. Thank you po, Chair. So, kaya ko tinatanong po yan kasi napansin ko, Mr. Chair, dun sa reasons for claims beyond 60 days, makikita mo na these are all mechanical. Nakalimutan ilagay kung donated ba o hindi ang kits, or hindi na ilagay kung ano ang patient priority subgroups. If you can show the slide again, sir, makikita mo na lahat sila mechanical, na kaya mong tugunan in 1 day or 2. So, ano ang dahilan kung bakit siya umaabot ng beyond 60 days? Kasi nangyayari doon, yun ang inyong paliwanag kung bakit umaabot ng 60 days. Tingnan niyo ulit. Kung pwede niyo, can you put up the slide?
Mr. Chair, as requested by the Honorable Madam Stella, we will flash it again to the board.
And sige po, and while you're doing that, ihanda nyo na rin po yung slide ng reasons for denial. And again, yung reasons for denial, in my mind, are all mechanical. Nakalimutan mag-attach, etc. Wala nga dun suspected fraudulent, which I believe is the most important reason kung magde-deny man kayo ng claim. It has to be because you suspect it to be fraudulent. Hindi po ba? So, pwede po pa natin balikan yung dalawang slides na yon, yung reasons for delay, meaning beyond 60 days, and the other is reason for denial.
Mr. Chair, while we are presenting at the board the statistics of the matter, I will add to the question, to the answer of, or rather to the question of the Honorable Madam Stella about the purpose of evaluation. Mr. Chair, I'm just new in the PhilHealth, no? Isang taon. And siguro, dagdagan ko lang din, no, sa aking analysis ko. Ang purpose ng processing, and hindi lang, of course, yung sinasabi ko na kanina, na para pangalagaan ang ating pundo, ating pera, na kailangan na yung pagbayad natin ay naayon sa ating proseso at saka sa auditing law. Siguro pwede ko nila sa dagdag na may mga ano po, may mga exceptions, no, yung ating medical processors na sinasabi po doon na Mr. Chairman na this is being returned for failure to observe yung minimum standard of care. Siguro sa ganang ganon, Madam Mr. Chairman, yan po din po ay pagre-review, no? Pagre-repaso ng isang ng isang dokumento para mapangalagaan din yung kapakanan ng ating mga miyembro. Pag may nakita ang doctors natin, yung ating evaluators na may kakulangan doon, so ibalik. At saka siguro itong Mr. Chairman, nakakatulong ito sa parting medical, sa area ng medical na ayusin.
Mr. Chair.
Ayusin
Mr.
po
Chair. Pwede bang balikan na lang ang question ko? Mr. Chair,
Yes, yes.
my question is about this slide. Ang tanong ko is, pag titignan mo yung reasons kung bakit natatagalan ang pagbayad, they're very mechanical. No value has been set for patient priority subgroup. So, tanungin natin ang PhilHealth, how long does it take? Ano yung remedy for this? The remedy for this is you indicate in the form the value. Tama?
Mr. Chair, Madam Chairwoman, Dr. Jonathan Eli po. Ma'am,
So
actually,
tell us, okay, Mr. Chair, para lang, yung top 3, can you tell us ano yung remedy for these top 3 reasons?
Mr.
Ito, no
Chair,
value has been set. Anong remedy?
Okay, Mr. Chair, Madam Chairwoman, I will answer po. This is Dr. Jonathan Eli. Ma'am, yung number 1 po, yung patient priority subgroup. Actually, this claim supposed to be should be RTH and others should be denied. Pero kaysa ibabalik po namin sa facility, inaantay na lang po namin yung documents na i-forward nila sa amin. But anyway, itong number 1 po, ma'am, patient priority subgroup.
No, so sandali lang. Nakasulat no value. So it's just a figure, a value that you need to indicate. Hindi na yan documents.
Ma'am, yung CIF, Madam Chair, I'm sorry. Yung CIF po kasi may tick box doon for the subgroup.
Okay,
And
so it's just a tick. Check.
yes, ma'am. And
Okay, so yun lang. If you put a check, na-solve na.
Madam Chair, may I po? For the subgroup letter A to letter E po, medyo walang problema because the doctors and the adjudicators can review the CIF kasi nakalagay po siya doon. Pero for the subgroup F to J po, ito na po yung may mga industries and yung sa court po na kailangan po may certification po from kung anong industry po sila and which
Okay, so
subgroup.
it's just a certification, which is also fairly easy to generate. How about itong no value has been set for whether testing kits have been donated or not? So again, there's just a tick box. You just have to indicate if donated or not. Tama?
Yeah, Madam Chair, yes po, tama po, but sometimes they fail to check po if
Okay.
the
All right.
kits and the services po. will
Okay,
provide.
Mr. Chair, my point being that looking at all of these reasons, there seems to be no reason kung bakit dapat siya magtagal ng beyond 2 months. So that's my first point. If we move to the next slide, dun sa denial of claims, can you just scroll down dun sa reasons for denied claims? Ito, looking at the reasons for denial, they're also very mechanical. Halimbawa, length of stay. Okay, so these are statutory, itong length of stay requirement. walang anything that says you suspect the claim to be fraudulent? Isn't that an important reason for possible denial? So, hindi po ba dapat, pag magde-deny kayo ng claim, of course, one, hindi siya nagme-meet ng statutory requirements, wala tayong magagawa doon. But number two, it should be those that are suspected to be fraudulent. Would you agree with that? Sir, Attorney Yaran, bakit wala ditong suspected fraudulent claims?
Ma'am, these are, Madam Chair, may I? These are top reasons po, Madam. So, kaya hindi po siya nasama. But doon po sa in-process claims beyond the 60 days, may nakasite po doon na yung double filing or same-day confinement. So, one patient po, dalawa ang claim na...
Okay, saan yun?
Okay po. Sandali lang po, Madam Chair. Madam Chair, ito po yun. So, isa po siya sa reasons why the claims are put on hold and it went beyond 60 days in process. Yung pinaka-last po natin, double filing or same-day confinement. So, one patient, dalawa po yung claim na sinadmit po ng facility.
So, it's an indicator of fraud.
There's a possibility na
Yes.
pwede po hindi. There's a possibility of
Yes,
fraud.
all right, thank you. Okay, I was looking at your Citizens Charter and the breakdown of the 60 days. And meron doon akong nakitang 10 days for adjudication. So, ang pagkakaalam ko, adjudication, the need for adjudication arises only if there's a probable cause, right? Ang ibig sabihin ba dun sa Citizens Charter ninyo, it's every single claim is treated as if potentially fraudulent, which is why it has to go through an adjudication process of 10 days?
Madam Chair, may I po? Madam Chair, the 10 days was yung maximum na po yun. So if there's hindi po siya automatic good claim, there's may policy or may something issue po, the adjudicator kasi has to consult her superior, the medical, the head of the BAS administration section for para makapag-decide po kung ano.
So what are the triggers for a claim to go into adjudication?
Madam Chair, ito rin po, as dito sa table, pwede po yung double filing because pwede naman po na dalawang claim ang na-file ng patient. Kasi, for example, may isang procedure ginawa, so, and it was not filed together with the first claim, so there's a possibility na dalawang claim.
Okay,
so, pag sa supervisor niya po, malalaman na hindi naman siya fraudulent.
All right, in your operations manual, are the reasons for adjudication clearly indicated? And can you give us a copy of that?
We can give you po the SOPs of e-claims processing po.
All right. So, and can you go to the slide that has the regional averages for turnaround time? So, Mr. Chair, the national average is about 36 to 44 days. So currently it's 41, last January it was 44. For the entire 2020, it's 42 days. So pero makikita natin dito across regions, malaki ang variations. So looking at BARM, for example, seems to have the lowest number. So average for January to August 2021 is 16 versus ang pinakamataas, I believe, is saan ba? NCR South. Pwede bang malaman anong reasons for this disparity? Is it because of the number of staff? Ibig sabihin, baka sa BARM, mas marami bang claims staff doon? So maaari bang malaman ilan ang claims officers sa BARM? So on the average, ilan ang hawak ng isang claims officer na claims at any point in time sa BARM? And what is that figure for, let's say, NCR South?
Mr. Chair, Madam Chairwoman, can I answer po? Ma'am, actually, the HR complement, inaayos po namin with the number of claims received. Isang reason po is the level of the facilities present in the borough. For example, sa central office, sa NCR Central, ang dami pong tertiary facilities. So yung cases nila talagang medyo toxic compared dun sa
Okay, yeah, but then obviously kahit naman sobrang daming hospitals, pero kung sobrang dami din ng claims officers ninyo, matutugunan niyo yung problema. That's why ang tanong ko ultimately is ilan ang claims on the average per claims officer at any point in time? So kunwari ako, claims officer ako, at any point in time, ilan ang hawak ko? At ano yung bilang na yon sa NCR versus, let's say, BARM?
Mr. Chair, Madam Chairwoman, ma'am, actually, we count on quota basis po. For example, for the doctors, at least makaprocess po siya ng 80 to 120 claims per day. Si adjudicator naman po, 150 claims per day.
Okay,
po.
simplihan na lang natin ang tanong. Ilan ang claims officer sa BARM?
Ma'am, for BARM po, we have 19 personnel po within the benefit administration section. Sa NCR naman po, sa
Sandali
North,
lang. So, sandali. 19 sa BARM. Ilan ang total claims process? Ilan ang total claims sa BARM nung what data do you have here readily? 2020? So kung i-divide mo lang yung total claims by the number of people, yun yung average number of claims per person.
Madam Chairwoman, may I check my data po?
Parang meron dyan nakita ko 5,013 somewhere. It's in the same deck. So ganito na lang, paki-compute para hindi ako mag-hold up ng line ng interpellators. Paki-compute yung average number of claims per staff sa lahat ng regions. And then babalikan na lang kita later on. And so for now, Mr. Chair, I'll yield to the next interpellator.
Thank you, Representative Imbo. Next to interpellate is the Honorable Ron Salo of Kabayan Party List. Representative Salo.
Thank you very much, Mr. Chair. Thank you. Good afternoon and good afternoon to all our resource persons. Susundan ko lang po yung mga tinatanong po ni Deputy Minority Leader Stella Kimbo concerning dun sa reasons for non-payment ng mga claims ng mga hospitals natin. Pwedeng ibalik po dun sa pinakita pong slide po kanina. Doon po sa reasons for non-payment or denial of claims. Okay. Doon sa next slide, please. Dito po, so common reasons for claims aging beyond 60 days. Mapapansin po natin dito, tama po yung binabanggit ni Deputy Minority Leader. Napansin ko rin po kasi lahat po ng reasons po dito, 31.56 times percent, etc., wala pong kinalaman po, I suppose, dun sa tinatawag po natin na fraudulent claims. Tama ba yon, Mr. Chair? Ang mayroon lang po dito yung 66.51% na dun sa pinakababa. Mr. Chair? Mr. Chair? Sino pong sasagot?
Mr. Chair, Dr. Eddie po. Yes, sir. Dito po sa top 10 po natin, Mr. Chair, dito po sa number 10 na po, appear yung double filing and same day filing.
Yes. Nandun doon sa dulo, 6.51% pinakadulo. Pero marami po dito, 31.56%, etc. Ang iniisip ko lang dahil bakit kapag in-adapt nyo po ito more than 100%? So ibig sabihin may mga various reasons. Ito pwedeng sabay-sabay. Tama ba yun? Tama ba yung reading ko, Mr. Chair?
Yes, sir. Pwedeng yung isang claim po has one of each po. So pwedeng walang subgroup, then wala siyang claim investigation for, and wala siyang summary for.
Yes.
Pwede.
So tama yung intindi ko na pwedeng sabay-sabay po sila, but kahit na sabay-sabay at nagkaroon po siya ng maraming reason, only 6.51% nagkakaroon ng chance na pumapasok po yung double filing o same-day confinement. Tama ba yon?
Yes po, sir.
Yes. Pero so far, magkano ang kapag binigyan po natin ng value po ito, at the same time, ilan yung number of claims na walang value, no value has been set for patient, priority subgroup, etc. At the same time, doon sa double filing, so 6.51%, ano yung percentage po na ito? Number of filing ba ito o amount being claimed?
Chair, Dr. Remonte po, may I be recognized? Ako po yung
Yes,
subject.
please answer, Representative Salo.
Okay po. Yun po no value has been set for patient priority subgroup. Hindi po yan amount. Yan po ay parang code po niya ng assignment kung anong subgroup po siya doon sa testing priority subgroup. So yan po ay A to J ngayon. Kaya po yan kailangan because yun lang sa sinasabi namin na yun lang po nandun sa priority subgroup sa mabayaran ng PhilHealth. Kaya po kung walang value po yan, hindi po yun mapaprocess kasi hindi namin alam kung sila nga ay nandun sa priority subgroup.
Thank you, Mr. Chair. Simple lang po yung tanong ko. Ang nire-represent po yung 31.56 is not the amount, but it represents number of times. Tama ba?
Yes.
Yung number of claims. Number of claims. Okay. So lumalabas po rito, with the total universe, only 6.51% yung nagkakaroon ng double filing. Pero so far, magkano yung amount that this 6.51% represent sa among all the claims? Na unpaid claims? Do you have the number? Kapag ibibigyan po natin ito ng value doon sa amount being claimed, ilan yung 6.51%?
Kung magkano po yan?
Yes. Yes, Mr. Chair.
Titingnan po namin yung ano.
So far po, magkano po ba yung total unpaid claim sa inyo? I-divide po natin government vis-a-vis private. Yung unpaid po, ito po yung, this represents yung binayaran po ninyo, total claim, pero doesn't state whether these are unpaid.
Mr. Chair, these are all the total claims in process. These are the unpaid claims, sir.
Lahat po ito unpaid claims.
Yes,
Okay.
sir.
So, total, when it comes to count, mas marami yung government, pero yung amount, mas malaki yung unpaid dun sa private. So total amount na unpaid ngayon sa private is 11 billion as of the moment. Tama ba?
Yes, Mr. Chair, based on amount, 55% of the total amount is for the private facility.
Yes, 11.5 billion yung unpaid. Pero ang tanong ko nga doon sa kanina, ilang percent ba yung supposed to be may fraudulent? Ilang amount lang ba yon?
Yes, sir. We're getting the computation, sir.
Okay. Kasi related din po ito doon sa in-issue po ninyo na temporary suspension of payment of claims. PhilHealth Circular number 2021-0013. Basahin ko po yung objective na nakasulat po rito. Sabi niyo po rito, this circular establishes the guidelines on the issuance of TSPC as a payment preventive measure against HCPs that are subject of investigation based on credible and verifiable report by the corporation or other duly authorized government agencies owing to apparent and probable presence of fraudulent act, unethical practices, and our abuse of authority. So binabalikan ko po yung listahan po ninyo kanina na 6.51% lang po yung probably magkakaroon po siya ng fraudulent claims. Pero kapag papansin po ninyo, all the rest amounting to 11.5 billion sa private and sa government 9.6 billion are unpaid claims. So hindi ko po maintindihan. Same dun sa concern po ni Deputy Minority Leader Stella Kimbo kanina, mukhang hindi ko po may pagtasa Hindi nagja-jibe, Mr. Chair. Hindi nagja-jibe yung reasoning po natin na sinasabi natin, isuspend po natin yung payment kasi meron siyang probably may fraudulent claim, unethical, or there's abuse of authority. But for all the reasons that you cited, iisa lang po yun and only for 6.51% of that. So what would justify na hindi natin babayaran completely yung kabuuan ng 11 plus 9, that's 20 plus billion, 21.1 billion, hindi natin babayaran lahat na embargo kung ang reason lang naman, ang pinag-uusapan lang naman na probably may fraudulent acts is that 6.1%. And most probably, kung 6.1% yon, less than 1 billion. From 21 billion, that's just less than or more or less 1 billion. So ano po yung rason, Mr. Chair? Bakit may embargo yung the entirety of the 20 billion na claims kung ang may issue lang po talaga dito with respect dun sa unpaid at probably may fraudulent acts is around 1 billion?
Mr. Chair, can we please recognize Attorney Emily Oroque to answer the question?
Yes, Emily, please respond.
Yes, sir. Thank you, Mr. Chair. Sir, while we are saying po na it appears na mechanical po, no, yung mga reasons ng beyond 60 days, this could also possibly lead to fraud, sir. Like for example, kung wala pong value na sined for priority subgroup, bakit siya walang value? It could also result to fraud. No value has been set for the flag indicating without attached valid case investigation form. Lahat po itong sir na reason na ito, lahat po ito could lead to fraud na nagiging dahilan why we need to have a further investigation, Mr. Chair. Hindi po, ito lang po yung sinasabi namin na on its face, may mga kulang. Pero bakit siya may kulang? Bakit hindi na-comply? Yun po ang kailangan nating bantayan, pag-aralan, to ensure that wala pong fraud. Eventually, sir, fraud pa rin po ang magiging main reason po ng PhilHealth for processing or sa pag-iingat po for processing the case.
Maraming salamat po, Mr. Chair, doon sa sagot po nila. Pero chine-check ko po yung dictionary ko po rito, mukhang malayo po yung rason at ibig sabihin po ng fraud. At lalo na po kapag ginamit po natin yung salitang fraud, that's a technical term na may ibig sabihin po yan sa batas. At klaro rin po na hindi po mapasok po yung binabanggit po nila, mukhang malayo dun sa definisyon at elements po ng fraud yung binabanggit. So ang tanong nga po rito, it's a simple process lang naman po ito, I suppose. Ngayon, kung medyo kailangan po natin i-justify with that particular reasoning, mukhang medyo mahihirapan po tayo dito sa committee to exactly identify kung paano natin ma-address po ito. Kasi with that reasoning, lahat ng rason pwede na nating ibigay, pwede nating ibato just to deny the claims. Kasi Kung sasabihin natin, i-connect po natin lahat po yun sa fraudulent simply because hindi po nila naglagyan ng value, Mr. Chair, ibig sabihin po nito, what's the purpose? Bakit pa natin kailangang i-identify what is fraudulent at what is not? Kung lahat naman po pala ng rason, link to fraud. Medyo malaki tayong concern po doon sa ganong argument, Mr. Chair. So ang tanong nga po natin dito, kailangan po natin basahin at repasuhin, balikan exactly. Bakit po, of course, ang aim po natin is bantayan yung kaban ng yaman, pera po ito ng mga membro, pera po ito ng mga mamamayan po natin na kailangan bantayan, siguraduhin. Pero hindi naman ibig sabihin po nito ay yung pagbabantay po natin ay i-deny mo ng i-deny sapagkat lahat ng rason ay i-connect mo doon sa fraudulent. So ang tanong po natin dito, kung ganun yung pamantayan po natin, Mr. Chair, meron ba tayong nakikitang solusyon dito? O ang solusyon po natin mag-adjudicate na lang lahat, mag-antay kung hanggang kailan matatapos yung adjudication process na sinet ng PhilHealth. Mr. Chair?
Mr. Chair, can we please recognize Dr. Gigi Domingo? If you please.
Mr. Chair. Mr. Chair, this is Dr. Gigi Domingo, Vice President po ng Corporate Affairs. I would just like to clarify po that the adjudication of medical claims, claims submitted to us, there are two types because it's not only legal. The adjudication process in medical claims processing is because we want to determine whether the claim is compensable or not based on our guidelines. So this is different po from the legal adjudication of cases. Ngayon, those values like the values that we need, whether the patient is, the case is compensable or not in testing, we follow guidelines kasi, for example, that case, we follow guidelines of the Department of Health as to who can be tested only, and this is the subgroups as mentioned in the testing. So without that, we don't know whether the case is compensable or not. So different po yung adjudication of claims processing doon po sa adjudication of legal cases. Thank you po.
Yes, Mr. Chair. Thank you very much for that particular clarification. So balit bumabalik pa rin po tayo sa primary issue. Sa dami po ng mga reasons po na yon, hindi ko po maintindihan, hindi ko po siya may tugma na ang primary issue, di po ba, kung 6.51% yung possibly linked to fraudulent acts, pero bakit na-embargo yung kabuuan ng 21.1 billion na claims po ng mga both private and public hospitals or health facilities. So, ano po ba yung primary na tanong po dito, pangwakas, Mr. Chair, ano yung resolution po rito? So, ano po yung nakikitang pamaraan ng PhilHealth to address this particular issue?
Chair, Dr. Domingo po. As we mentioned po, not all claims that 21 billion po na sinabi namin in amount are delayed claims. Those are claims that are being processed in our offices po. So what we're doing now is that we have informed our regions to discuss with our hospitals, find out the reasons for this return to hospital, and discuss with them. Mostly po, tama po kayo, is documentation. And therefore, some of our regions are doing information campaign dun sa ating mga hospitals to properly fill up po the forms para hindi na rin po mag-return to hospital to. Aside from that po, we just met with the hospitals and we agreed to come out with a technical working group with our hospital partners to be able to go to the root causes of this RTH and hopefully eliminate na po ang RTH na po. Thank you po.
Thank you very much, Mr. Chair. I cede now to the other interpellators, but at the same time, this is really an appeal on behalf of our health workers as well as yung mga facilities po natin. Of course, nakita po natin, nagwo-walkout na po yung marami po sa mga health workers po natin. At ngayon, magwo-walkout na rin po yung mga health partners po natin. So antayin pa ba natin na completely mag-walkout na, terminate po nila yung kanilang services sa mga kababayan po natin, lalo na ngayon na gitna ng pandemya. So with that, Mr. Chair, thank you very much for the opportunity.
Thank you, Representative Salo. We go back to, before we continue, I'd like to acknowledge presence of Representative Presley Diaz de Jesus. We go back to Representative Stella Kimbo.
Mr. Chair,
Yes.
ayon sa RA 7875, Section 23, letter J, the processing of claims should be done within 60 days, whenever applicable, in accordance with rules and guidelines of the corporation. And meron naman tayong rule, meron naman tayong PhilHealth Citizens Charter that clearly indicates na 60 days talaga ang ina-adapt na standard ng PhilHealth. So, ang tanong talaga, as you had pointed out earlier, anong gagawin natin na sa ngayon, ang sitwasyon is 49.5% of all claims are already beyond 60 days. So, yan na nga po. So, yan ang tanong. No? So, merong batas at mukhang merong paglabag ng batas. And nakakalungkot na tila walang maliwanag na standard ng fraud. So can I confirm that from PhilHealth? Meron ba kayong ina-adapt na legal standard ng fraud? Ibig sabihin, at what point will a claim be considered as possibly fraudulent? Alam naman natin, Mr. Chair, na ang usual na tinatawag na fraudulent claims ay yung merong upcasing. Ibig sabihin, yung case rate na ginagamit would be higher than what it ought to be, medically speaking. Number two, meron tayong yung straightforward na ghost claims. Ibig sabihin, nag-claim against PhilHealth, pero hindi naman talaga nag-exist ang patient na yon. So these are examples, common examples of fraudulent claims. But may I ask, PhilHealth, meron bang kasulatan, meron ba kayong rules of procedure na kung saan maliwanag ang legal standard ng fraud pagdating sa claims?
Mr. Chairman, to the question of the Honorable Stella, the 60 days mandated is the maximum number of days that the corporation has to pay. But let us also be conscious, Mr. Chairman, that even to the statistics that we have indicated in our presentation, while 60 days is the mandated number of days, but there are also what we call these regions that even submitted the average turnaround time that is less than 60 days, Mr. Chair. So there must be reasons, Mr. Chair. And for the legal matter, Mr. Chair, I respectfully refer the matter to our legal for answer to the query of the Honorable Stella. If you please, Mr. Chair. Attorney GM Tolentino, if you recognize.
Attorney Tolentino.
Yes, Mr. Chair. Good afternoon to everyone. Under our UHC Act, Section 4, on the definition of terms, letter J, fraudulent act is defined as it refers to any act of misrepresentation or deception resulting in undue benefit or advantage on the part of the doer or any means that deviate from normal procedure and is undertaken for personal gain, resulting thereafter to damage and prejudice which may be capable of pecuniary estimation. In our recently issued PhilHealth rules on administrative cases under Section 55 on the definition of offenses, subparagraph A enumerates the fraudulent acts committed by either a healthcare facility or a professional, among which includes padding of claims, submission of claims for non-admitted or non-treated patients, extending period of confinement, post-dating of confinement period, misrepresentation by furnishing false or incorrect information, fabrication and or possession of fabricated forms and supporting documents, and other fraudulent acts. The example given by the Honorable Kimbo on upcasing is falls under unethical acts dito po sa ating rules of administrative cases. Unethical acts, if I may enumerate, Mr. Chair, includes overbilling, upcasing, upcoding, diagnosis creeping or procedure creeping, recruitment practice, harboring ghost patients, andun din po sa unethical. Tsaka refusal to admit and or provide appropriate service. Lastly, yung abuse of authority. It's another classification of prohibited acts. It includes filing of multiple claims. Previously fraudulent na classification yan, pero ngayon po abuse of authority yung classification niya. Non-compliance with no co-payment policy, breach of warranties of accreditation, and unauthorized procedures beyond service capability.
Okay, so Mr. Chair, how many findings of fraud have you had this year? 2021. You had legal, right, sir?
Yes,
you had
ma'am.
legal. Okay, so lahat ng fraudulent claims or cases of fraud sa'yo dumadaan.
Sa department ko po, sa
yes,
fact
okay.
finding.
So you would know.
Yes,
how
ma'am.
many findings of fraud this year?
Findings, decisions, ma'am, or yung ni-report
yes, decisions. Final decisions.
Ma'am, sa ano na po yan, sa adjudication department na po.
Okay, so who is the
that's not
reference
legal
person?
Although I understand the appropriate department submitted po yata yung list ng mga decided cases.
No, just give me the number. So who is the best person to speak about fraudulent claims in PhilHealth?
Mr. Chair, I would suppose it's the adjudication department kasi po sila po yung nagbibista at nagde-decide.
Okay, and where are they? Are they with us this afternoon? The reason for why I'm asking these questions. Oh, yan. How many, sir? How many final decisions where you find fraud? Where you have a finding of fraud? Sir?
Hello, Vice President Jay.
Yes, sir. This is Attorney Villegas, Mr. Chair of PhilHealth, the head of arbitration office.
Yes, please answer, Jav. How many have you decided for 2021? In
For
the yeah.
Yes, sir. For 2021, sir, we decided about 800 cases with fraud cases po yun. 800 claims lang po. 800 claims.
800 claims out of how many millions?
39,000.
Ma'am, yung 800 is out of 8,000 cases po sa PhilHealth.
No, what's the total number of claims for that reference period that you're talking about?
800 po yun. 800 claims po siya. Yung po ang decided case with fraud.
Sa lahat ng claims na final, hindi ba millions yun?
39,000 2021.
39,000. So of the 39,000, tama ba 39,000 lang ang claims? I think it's more than that. You should know the number, sir.
We submitted our reports,
Okay,
ma'am.
wait. Okay. So of the 800, so 800 ang findings of fraud.
Decided. Yes po.
Dun sa kaninang reasons for delayed claims, yung reasons for why beyond 60 days ang claims processing. Related ba yon doon sa findings niyo of fraud? Ibig sabihin kapag yung tao nakalimutan maglagay kung donated or not yung testing kit, or kung yung hospital nakaligtaan ilagay kung ano yung patient priority subgroup, nakaligtaan ang certain attachments, yun po ba ay nakikita ninyong correlated dito sa fraudulent claims?
Yes, ma'am. Thank you, ma'am. To respond po sa answer nyo, I would like to clarify po, yung pong kanila pong reasons for the beyond 60 days, hindi po siya connected actually sa fraud. Yung po ay mga requirement ng ating claims processing, kung ano po yung mga required information.
Correct. Pero ultimately the reason for why we spend time and effort processing the claims is, again, we want to prevent fraud, right? Ayaw natin na mali ang claims, gusto natin tama, right?
Yes po.
And so nagtataka kami kung bakit nyo tumatagal ng todo-todo, mukhang sa amin na hindi taga PhilHealth, parang mechanical, nakalimutan lang i-tick kung donated or not yung testing kit, nagtatagal na ng 60 days. So sa amin, legit yon kapag mukhang related siya sa fraud, katulad ng sinabi ni Attorney Emily Roque. Sabi niya, hindi, lahat yan, pwede yan maging fraudulent. Kaya gusto ko ma-validate po sa inyo kasi kayo pong ang opisina po ninyo ang siyang nakakapaghanap ng fraud findings. So gusto natin malaman, ano ba yun? Kumbaga senyales ba yun? Na kapag nakalimutan ng isang ospital na mag-tick ng donated or not ang testing kit, ay parang tila nagiging fraudulent yung claim.
Yes, ma'am. Clarify ko po ulit. Yung po kasing documentary requirements or information required to process claims, doon po natin makukuha ang information kung merong misrepresentation or merong fraud. That is why po, yung pong nire-require na mga information na mag-tick ng information po sa claim form, required po siya from the hospital.
Okay, so in other words, natitenga lang siya. Hindi siya yung pag nakalimutan mo mag-tick ng box ay nalalagay na siya sa possible fraud. Anong nangyayari is napaparking lang siya. Naiiwan lang siya dun sa opisina kasi hinihintay nyo lang na i-submit sa inyo yung kulang na information. Ganun na nangyayari.
Yes, ma'am, kasi required nga po yung document at information.
So I guess ultimately, ang tanong is, bakit hindi nyo i-follow up? Bakit umaabot ng 60 days ang pag-follow up na napakasimpleng information? Sino kaya ang pwedeng sumagot nun? Hindi ba pwede tayo maging proactive?
Ma'am, Mr. Chair, ang understanding ko po, yung po mga claims processor natin sa mga regions, na-coordinate po nila kung meron po mga hindi na submit na documents or information na dapat i-submit sa PhilHealth. Siguro po ang problema is communication ng hospital kung kailangan ang patient na magkaroon na kumuha ng information sa patient. Yun po ang nagiging hindrance siguro, or yung pong pag-respond ng hospital sa specific claims na required po ng PhilHealth.
Okay, thank you. I have a question for Attorney Yaran. Attorney Yaran, how important to you is itong compliance with the 60-day rule? Ito po ba, is this something that you take up regularly in your board meetings? How often do you monitor? How often do you monitor itong average turnaround time?
Mr. Chairman, that 60 days is very important because that is jurisdictional, that is by law, that is by policy. So it's important po.
So anong gagawin ninyo na 49.5% are beyond 60 days? What steps have you taken? And as you said earlier, I'm somewhat disappointed that you have not talked to any claims officer yet. And I think you've been in your position for how long now? Is it 1 year?
That's almost 1 year, Madam.
Almost 1 year. And so it's somewhat disappointing that you have not spoken to any claims officer, considering that unpaid claims is a big issue na nagkukos nga ng possible disengagement ng hospitals. Ano ang steps moving forward?
Mr. Chair, one of the strategies that we are pursuing right now is aside from those DCPM, aside from those virtual augmentation of our personnel in areas where there are a lot of claims. We always tell our people to make representations or communicate directly, or what we call reconcile our records with healthcare institutions. We have people that are going to the hospitals to make this reconciliation. Not only about the books, but aside from the modules, of course. Ibig sabihin, pag-uusapan ko, kausapin yung hospitals. In all my meetings, hindi naman all, last meetings dahil ito na nga, problema na nga ito, sabi ko sa kanila, yung mga RBPs, yung mga officials sa region, you talk directly to the hospitals para isettle po itong problema po.
Hindi kaya kulang ang tao nyo? Kaya pwede ko bang balikan yung hiningi ko na information earlier? Yung number of claims per claims staff, claims officer, for the best performer and for the worst performer. Is that something that has been computed? Mr. Chair, I asked this earlier. I can't remember kung sino po yung kausap ko. Si Dr. Yung nag-present po ng slides earlier.
Mr. Chair, Dr. Riza Herrera, if I may be recognized.
Yes, please speak loudly, Dr. Risa. Hello po.
Yes, sir. Can you hear me now?
Yes, yes.
Yes, sir. So, we have computed po based on the number of claims received for 2021. Pasensya na po sa matrix, medyo rough po. But this is the computed average, computed number of claims per row. So for car, for 1 month, they have received, this is for August 2021, the third column is for August 2021, 1,038.65 claims available on recent computation. So on a national average, sir, it's 11,815. On the next column to the right is for 8 months, based on the number of claims that we received from January to August, we received an average, we received an average of 12,473 nationwide. And this is shown by region on the fourth column. Over.
So Mr. Chair, wait. What I wanted was, so these are total claims. Total claims, hindi niyo pa dinidivide. Madam? So, Okay, ang gusto ko is number of claims per staff. So sa BARM, halimbawa, from January to August, ang total is 200, or sabihin natin, sige, let's look at the monthly. So in BARM, 269 claims per month divided by 19 people. So about 14 claims per person per month versus NCR South ba to? Which is one. Tama ba? Sino ba yung kausap ko?
Yan per staff na po.
Sorry?
Average na po na number of claims per
staff. Which one? The 19? Halimbawa sa...
Pareho po ma'am, yung third column is for 1 month. And
Okay.
yung fourth column is January to August po.
Okay. So per person to?
Yes ma'am.
Per person. Okay. So sa BARM, it's 269 per person per month. Versus halimbawa NCR South, which is 162 per person per month. Pero bakit ganon? Yung BARM yung mabilis, pero mas maraming hawak per person kumpara sa NCR South. Anong paliwanag po doon? Akala ko kasi it had to do with kulang ang staff sa certain regional offices, kaya nagtatagal ang claims processing. Pero base sa data na to, tama po ba ang aking observation na hindi related sa dami ng tao? Kasi yung BARM na kung saan mabilis ang pag-process, ang bawat staff ay humahawak ng 269 claims per month. Nadihamak na mas marami kumpara sa NCR South na 162 lamang ang claims na hawak. So anong paliwanag kung bakit may mga regions na mabibilis at may regions na sobrang bagal? Mr. Chair, sino kayang pwedeng sumagot?
Si Doktora Lisa.
Kasi naghahanap tayo ng potential na solution moving forward, Mr. Chair.
Hello? Anyone from PhilHealth? Dr. Lisa po, yung kausap namin kanina.
Can you allow us a few more minutes to check for the data?
Siguro,
Opo, yes, balikan na lang po natin, Mr. Chair.
Balikan na lang natin muna, kung Stella.
Sige po, I'll yield na lang po to the next and then later on na lang po,
Okay.
I'll ask about the second reso. Salamat
Okay.
po.
Thank you. We need now go to Representative Marino. Sir?
Thank you, Mr. Chairman. My question is regarding the process. From what I understand, the hospitals will submit the documents to PhilHealth and then they will process the claims. The question is, how long does the process take, and then how long before they inform the hospitals of their deficiencies? And do they have a system on the documentation on how to trail the process? Kasi baka po naman, okay, may kulang nga po yung hospital, pero hindi naman nare-relay sa kanila yung deficiencies. Ano ba ho yung mga documents? Is it physical documents ba ho, yung they send it back, they get it, or do they have a system na, just informing them na kulang lang pala ng check or whatever? Baka naman masusolusyonan po natin yung problema if we can keep track of the process. May date po na na-receive, may date po na in-inform yung hospital. Meron po bang ganun system, Mr. Chairman?
Will you please recognize Vice President Waway Bacarisa?
Yes, before we continue, I'd like to recognize the Honorable Gabriel Bordado. We'd like to recognize the Vice President. Sino po yon? Sino po yon, President Garan?
Waway Bacarisa, Mr. Chairman.
Waway Bacarisa to answer the question of the Honorable Marvy Marino. Hello, Walter Bacaresa.
Mr. Chair? Mr.
Yes.
Chair, can you hear me?
Opo. Ito lang po yung
Yes,
tanong.
sir. Yes, sir. We have, we have 60 days to process the claims, and we have actually embarked on a weekly, weekly reconciliation with the hospitals already para we will be appraising them of what happened to their claims, sir. For example, pag RTH po, we have now a weekly discussion with each hospital on the causes of RTH and denial po. So far po, the denial is at, actually sir, the denial has actually gone down to 1.7% for 2021. So lumiliit po, the good news sir, ang denial natin ay lumiliit. From an average of 3 to 4% per year to 1.7 as of June. Mr. Chair.
Yes. Mr. Chairman, nga po, ngayon po natin ginagawa yan. Pero ang tanong ko po is before, ano po yung documentation nyo nung trail nung process? When did you receive the date you received the document and then you processed it, di ba? How many days? Does it take you 5 days, 10 days? And then after that, naka-document din dapat nung pinadala ninyo yung deficiency doon sa hospital. I understand you're doing that now on a weekly basis, but you cannot be doing this if you don't have a technology in which it is online that you process the claims and there's a paper trail. Kasi hindi po natin malalaman yung kung sino po may pagkukulang, whether the hospital is not submitting to you the documents or their deficiencies, then they're the ones to blame, correct? Tama po ba ako? Pero if you're the ones not communicating the deficiency to the hospital, then there is a problem, Mr. Chairman.
Yes, sir. Mr. Chair, may I answer, sir?
Yes, sir.
Nung una, sir, we actually have a biannual event called Reach Out, so we can reach out to the facilities in order to discuss this denied and return to the hospitals. And pasalamat po kami sa Congress, actually, sir, especially sa North Luzon Growth Quadrangle, sir. Kaya naging weekly. We have depende po sa depende po sa facility. We have actually initiated yung ERTH and E-denied claims in various stages of implementation. And we also have direct email and hotline to the facilities para mapag-usapan po kung ano ang causes of RTH and denied. And ngayon, sir, we are also intensifying our reconciliation with them para po maayos po na itong question on denial, return, and fraud, sir, Mr. Chairman.
Well, sir, I understand what you're doing right now. In fact, I appreciate, yung RD namin dito sa PhilHealth already set an appointment with the hospitals and with me, and I thank you for that. I acknowledge that there is a communication already. Nagpapasalamat po ako kay President Giran dahil nung last time I questioned it, kinabukasan po tumawag naman sa akin to set an appointment and I assume that it will be corrected. Hindi po yun yung tanong ko, sir. Ang tanong ko po is meron ba kayong sistema to keep track all these documents to and from PhilHealth and to the hospital para hindi na tayo dumating sa point na you have to physically go to meet the hospital owners and such. You have to have a system. You have to use a technology. Yes, kung kulang lang ng check, I mean, you can, you have one form and then they can check it on that form and then you can view it. Yun lang naman po Mr. Chairman, I understand you have a technology, but you know, one of the hospitals told me hindi po mabasa yung ibang documents dun sa technology ginagamit ninyo.
Mr. Chair, if I may answer, sir. Yes, sir. Meron po kaming technology, sir, no? For example, sir, for each hospital, sir, meron po kaming speedometer to measure the speed of payment. We also monitor, sir, turnaround time of the hospital, sir, from discharge to submission to PhilHealth. Because if you noted, sir, about almost 50% po ng cost of denial is actually very mechanical in the part of the hospital, sir, yung beyond 60 days o beyond 120 days. Kaya palagi po kami nagko-communicate sa kanila to please submit their claims to us on a timely fashion because 50% po ng cost of denial, sir, is submission lang sa amin. And we cannot do anything about it kasi nasa kanilang korte po yung pag-submit, sir.
Yes, I agree. Hindi nga po natin malaman kung sino yung may pagkukulang kasi hindi natin alam yung trail nung documents eh. Hindi nyo po nire-record. My question is, do you have a record of the trail and also an ID number of the documents? Halimbawa po, pinadala sa inyo ng isang hospital yun. There's an ID number, di ba? So yung document na yon, saan siya dumaan? Ilang araw tumigil sa inyo? Ilang araw bago nyo na-notify doon sa hospital? Bumalik ba uli sa inyo? So doon po nagkakaroon tayo ng problema. You're correct. I don't doubt that the problem is, deficiency. But the faster you communicate, the faster you can remedy the deficiency. Tama po ba ako, Mr. Chairman?
Exactly correct, sir, Mr. Chairman.
So, dapat po may system talaga kayo. Meron po ba kayo wino-work out na system?
Yes, sir, Mr. Chairman. We have a system to track each and every claim. Except those claims that were binato po sa amin at hindi natanggap ng PhilHealth. And we can also measure po that number, sir. Once the hospital will reconcile with us or kami magipag-reconcile with the hospital, sir. But I am very happy. Yes, sir.
Mr. Chairman, siguro po malaman na lang natin yung system na yon. Kasi that will make a difference between, arguing who's may kasalanan kasi nalilate po yung payment, malalaman po natin. Can you submit maybe some information on how you do the process?
Yes, sir.
Example lang po. For example, document 1 came in on this day and then it was processed for 2 days and then you sent it to the hospital, no response for 5 days. So malalaman natin bakit lumalampas ng 60 days.
Yes, sir. We will submit, sir.
Thank you, Mr. Chairman. Again, I'd like to thank PhilHealth. After that, the other week or 2 weeks ago, they responded. They communicated with me and also the hospitals. I verified that with the hospitals. I think they have a meeting with the hospitals now this week. So I will wait for the evaluation and result of the meeting. Again, thank you very much, PhilHealth. Thank you, Mr. Chairman.
Thank you, Marby. I'd like to thank you to President Geran for heeding the advice to meet with the majority of those who have complaints with PhilHealth so that everything will be trashed out. Because, a lot of people are relying on PhilHealth and on the hospitals. So you yourself, President Geran, thank you. Kayo dun po nagsabi na yung mga hospital ang kailangan nyo since wala kayong sariling infrastructure to serve our people. So kailangan yan hand in hand. So let's go back to Representative Stella Kimbo for Resolution 1170 for your interpellation.
This is the second reso, Mr. Chair. But before we go to that, nandito po ang COA. Let's take advantage of the presence of COA. Baka pwede natin po silang hingan ng kanilang observation so far. They think that COA is violating any particular rule. Pwede rin silang mag-comment on the circular on temporary suspension of payment of claims.
Okay. Please proceed for you can ask COA to
Nasaan po
their
si... Opo.
the supervising auditor for PhilHealth.
Sir?
Hello. Yes, the representative of COA, the supervising auditor of PhilHealth, are you here? Hello.
Sir, Mr. Chair.
Yes.
Yeah. Yes. Attorney Ridgway.
Yes, sir. We have prepared our position paper, Mr. Chair, and we're just waiting for the signature, Mr. Chair, and we will submit it.
Give us based on the topic at hand, which has now been discussed on the second hearing for 2 hearings. Is there any statement or summary of findings that you can give the committee?
Mr. Chair, the supervising auditor of the PhilHealth is, I believe, is attending the hearing as well. May I refer the question to the supervising auditor, Your Honor.
What's his name? Please identify yourself. Hello.
Hello.
Oh, yes, sir. Abdul.
Yes,
Faisal.
Mr. Chair.
Yes.
I am the current acting supervising auditor of PhilHealth. Okay, so with regard to the delay of the processing of the claims, we do have this finding in 2019, although it is also included in the 2020 audit report, but still our 2020 annual audit report is still for finalization and it will be released soon. But although in 2019, we do have a finding about the delay of the processing of the claims of PhilHealth. So it's already stated.
Oh. Hello.
Yes, sir.
Yes. Please continue. You were cut off.
What I have said, sir, earlier is that we already have findings on the delayed processing of claims of PhilHealth. It already stated in our or appeared in our 2019 annual. The 2020 annual audit report is under review and for release soon, sir.
Okay. Representative Kimbo, you have questions for Attorney Abdul Faisal?
Nakikinig ka naman kanina, sir, di ba, sa discussion?
Yes, ma'am.
Meron po ba kayong preliminary assessment on whether or not there are any violations committed by PhilHealth pagdating sa payment of claims na beyond 60 days? And the data would show that 49.5% of these claims are already beyond 60 days. And based on their citizens charter, 60 days lang talaga ang maximum period.
Hello. Yes, ma'am. We do have this finding in 2019 and also in 2020 that it shows in our audit report that for 2020 alone, there are around 49% of the claims that has been processed for 2020 processed beyond the 60 days.
Okay, so siguro po hihintayin na lang po namin ang inyong position paper after it gets approval for release. Sige po, salamat po. So
Thank
Mr.
you.
Chair, I'll proceed to the next resolution. I'd like to ask the Insurance Commission, which I believe has started to audit the actuarial projections of PhilHealth. So may we hear from the Insurance Commission if they are with us this afternoon?
I think they are not with us. Are they with us?
We
Yes.
did not issue an invitation to the insurance.
Oh, okay. All right. So can we have the PhilHealth actually then report the findings of the Insurance Commission with respect to their actuarial projections?
Attorney Guerrano, is there anybody to brief us on the findings of the Insurance Commission?
Thank you, Mr. Chairman. Can we please recognize Executive Vice President Eli Santos, Mr. Chair?
Yes, EVP Santos, please proceed.
Kasi aglipay pa. Ito pala.
Hello, we can hear you. Hello, EVP.
Can you hear me now, Mr. Chair?
Yes, yes, but we cannot see you.
May I proceed, Mr. Chair?
Yes, yes, please.
Mr. Chair, this is a briefer or a report with respect to the third-party audit conducted by the Insurance Commission. So in light of the implementation of RA 11223, the Insurance Commission was requested by the Secretary of Finance to assess, examine, and verify the financial condition and methods of doing business of PhilHealth pursuant to the Insurance Code of the Philippines as amended. In 2019, a MOA was executed between PhilHealth and the Insurance Commission. Under the MOA, IC shall assess and provide examination report on the financial condition and methods of transacting business of PhilHealth as of December 31, 2018. The examination shall cover different areas such as benchmarking of PhilHealth's financial condition using the same parameters being applied to a regular insurance company. Second, validation of collection and payment system. Third, reserve fund assessment. And fourth, review of contracts, policies, and board resolutions. On May 25, 2021, the IC has presented the initial findings of its audit of PhilHealth to the Secretary of Finance. Subsequently, the PhilHealth presented its rejoinder and action plan on June 15, 2021. While some of the audit findings and recommendations were already closed, the IC team proceeded with the audit given that some documentary requirements were recently provided by PhilHealth. The findings, observations, and recommendations of IC were presented during the August 6, 2021 meeting with the Secretary of Finance. On August 12, 2021, the internal audit group of PhilHealth, acting upon the directive of the PhilHealth Board of Directors to monitor the progress of PhilHealth management's action to the IC audit observation, issued IAG Memorandum 2021-093. The Office of the Corporate Operating Officer must provide updates on action taken to address the audit findings of IC. On August 27, 2021, the IAG presented the updates of action taken to address the audit findings of IC to the PhilHealth Board. On the same day, the PhilHealth Secretariat provided to IC the necessary documents to close the findings and observation of IC. Mr. Chair, Mr. Chairman, Honorable Representative, PhilHealth will provide this document to this honorable committee regarding the audit conducted by IC. Mr. Chairman, Honorable Representative Kimbo.
Mr. Chair, tanong lang natin yung bottom line, no? Ano ba ang estimated actuarial life ng PhilHealth at this point?
Mr. Chair, Madam Honorable Congresswoman Kimbo, Neri Santiago po. Can you hear me clearly po?
Yes, yes po.
Okay, thank you. I'm with the Office of the Actuary po. The estimated actuarial life for now is until 2027 po, yung actuarial life.
Can you explain to this body what that means?
That means po, yun pong reserves, considering yung ma-receive ng collections as against dun sa benefit payouts, it will only last until 2027.
So ang ibig sabihin nun, magsasara ng PhilHealth after 2027?
Based po sa projections po yun. So there could be instances na the assumptions can be different from what will transpire in the future po. For example, the assumption that is in the projection will depend on the subsidy coming from the government with respect to the premium contribution for the indirect contributors. And it will also depend on the rollout of benefits, benefit enhancement in the future. So, marami pong dependencies yung actuarial life po.
And the Insurance Commission validated this finding na hanggang 2027 na lang ang PhilHealth?
Thank you, Honorable Congresswoman. For now po, wala pa po silang actuary on hand. Kasi po, they were supposed to procure the services of a consulting actuary to validate the projection. So, I think they are in the process of procuring the services. So, initial findings pa lang po yung naibigay nila for the actuarial projections validation. Madam Chair, Mr. Chair.
Okay. Normally, sa isang social health insurance program, ano dapat ang actuarial life?
Depende po kasi sa isang social insurance institution, no? Kung sa health insurance po, this is a living benefit. So, usually po, this is a pay as you go, but since we have the lifetime member reserves, lifetime member program, wherein we give benefits without the collections, corresponding collections, para po nagiging, there is a long-term na, benefits, the benefit payouts. So, iba po siya kaysa dun sa pension, which is GSIS and SSS, in the sense na yung premium na nare-receive ngayon will be given as a benefit in the future when they retire. But for health insurance, the benefits are being given whenever a member gets confined or needs medical services.
Okay, so kung tama ang intindi ko, ang isang normal na health insurance program ay dapat going concern. Wala dapat pinag-uusapan na tanning. Kasi kung ano ang appropriate na premium para masustain ang benefit payments, yun dapat ang makolekta. At pag makolekta yan, ay walang dahilan kung bakit magkakaroon ng tanning ang insurance program. Tama po?
Tama po yung ganoong proseso para po sa private health insurance because the premiums are commensurate to the benefits being paid out. Ang difference po ng social health insurance. Ang social health insurance po kasi, legislated yung collections based on the rate and salary, which is not commensurate to the benefits being given. So kung hindi po balansyado yung collections as against sa benefits, hindi po siya equivalent to a going concern.
Okay. So sa ngayon, bakit hindi nyo binabalanse ang benefit payment doon sa tinatanggap ninyong premium collections? Pwede, okay. Bago mo sagutin yan, sa taong 2021, magkano na ang collections ninyo?
Yung pong as of
latest report.
Mr. Chair, may I be recognized? Attorney Emily Roque, the Fund Management.
Yes, Attorney Roque, please proceed.
For as of December 2020, we have 149 billion premium contribution collection of premium income. Then tentative po, ma'am, for June 2021, we have 87.7 billion premium contribution collection. Tentative.
Sandali lang po. Yung 87 billion is January to June 2021. Tama?
Yes, ma'am.
Okay. Doon na lang tayo sa January to June 2021. So 87 billion ang collected for the 6-month period. Magkano po ang benefit? Yes po. Tama po, 87 billion?
And then 87.7 billion, ma'am.
Okay,
For the
87.7. For the benefit payout for the same period, meaning January to June 2021, magkano po?
Including accruals, Madam Chair, is 52.3 billion.
52.3 billion. Sorry po?
52.3 billion.
Okay.
That will include, ma'am, Honorable Congresswoman, and paid and accruals po from the actuary.
That's total benefit payments. Paid and accrued.
Paid and accrued, Madam Chair.
Tama, okay. So, yung ganun kasimpleng accounting, collections minus benefit payout, clearly naman positive. Meron kang 32 billion, kulang-kulang, for January to June. Tama? Na excess?
Yes, ma'am.
Hindi pa natin nilalagay diyan ang investment income, etc. Correct?
Yes, correct po.
Okay. So we are clearly doing okay. Tama?
Yes.
Okay. Anong dahilan kung bakit mamamatay na ang PhilHealth sa taong 2027?
Mr. Chair.
Ano po ang projection ninyo for the entire year for 2021?
Mr. Chair.
Ano ang projected net income considering na meron na tayong about 32 billion from January to June of this year? Ano ang projections natin for the whole year 2021?
Mr. Chair, Kimbo, ang projected na ano po natin, net income for 2021 actually is a net loss. This is strictly
how much?
2021.
For 2021, magkano net loss?
Yes po. Ang ano po,
Magkano?
yes po. Ang net loss po na in-expect natin for 2021 is about 57 billion.
Okay. Please explain to me. From January to June, tinitignan ko lang ang premium collections minus benefit payments. Meron ka ng, you are ahead by 32 billion. Hindi pa natin ina-add dyan ng investment income kasi malaki ang interest na kinikita mula sa reserve funds ng PhilHealth. Hindi pa natin yan nilalagay dito. So clearly, magkano bang investment income ninyo last year?
Nasa 9 billion.
9 billion.
Nasa 9 billion. Okay, nasa 9 billion. So sabihin natin kalahati nun. Sabihin natin 4 billion. So, kumita kayo ng mga siguro 40 billion the first 6 months of this year. Explain to us why you will lose 57 billion for the entire year. That will mean losing 57 plus 97 billion in the next 6 months. I cannot imagine how that will happen.
Mr. Chair, Madam Congresswoman, yun pong for one, yung collections na 80 billion, this includes 8 billion na supposed to be payable in 2020, which was only paid in 2021. So, kasama po yun dun sa 80 billion as of June. And for the second half of 2021, we expect a surge in terms of COVID claims. Because dito po nag-surge into 22,000, 16,000. For now po, ang lowest for the past...
Madam, kahit mag-surge pa tayo, hindi ka malulugi ng 97 billion. Kasi 5% lang ng cases ang ma-hospitalize. So, can you just submit to us? Kasi talagang, pasensya na, no? Because this is a very important matter. Hindi katanggap-tanggap yung idea na mamamatay na po ang PhilHealth in 2027. That's not an acceptable idea. So hindi namin, and from January to June, malaki pa ang kita natin. And in fact, if you will continue to collect as much as you collected last year, which is 149 billion, that means you will collect another, say, 50 billion in the next 6 months. So, hindi ko talaga maisip, pasensya na po, kung paano ang ending natin sa 2021 ay net loss of 57 billion. So, hindi natin yan masasolve ngayong hapon na to. So, Mr. Chair, baka pwedeng isubmit po sa ating committee, lahat po ng projections na yan na nabanggit ni Madam Actuary, para pwede natin pag-aralan. And at the same time, baka pwede po natin isangguni sa Insurance Commission para lalo natin maintindihan ang sitwasyon ng PhilHealth. Is that okay, Mr. Chair?
Mr. Chair, Larry po. Okay po, we will submit more information. Actually, we have submitted this projections. We can siguro elaborate more on the assumptions so that we can explain why we are projecting this much. In terms of referring to the Insurance Commission, I'm not sure po kung on board na po yung consulting actuary nila who can help them with the validation of the projections. We'll coordinate.
Okay, so your first assumption is magkakaroon ng sobrang daming COVID cases. May we know what your assumed number of COVID cases would be?
Dalawa po kasi yung COVID na binabayaran natin, inpatient as well as yung tests.
So can you give us the assumption?
So ang sa inpatient po, comparing it to the DOH data na confirmed cases, ang natatanggap po natin for inpatient is about 20% of what had been reported by DOH in their data drop, So far po, the confirmed cases as of August 15 is 1.3 million cases. And projecting this to the end of the year, about 2.4 million po ang magiging confirmed cases natin on the DOH data. If we will use the 2020 experience, wherein 20% of the DOH confirmed cases were received by PhilHealth, so mga 473,000 po ang magiging confirmed confinements. As for the tests, last year po, we paid 2.5 million tests for 2020. And this year po, we expect about 6.5 million tests to be paid out of the expected 18 million na tests that will be conducted in 2021. So, yun po.
So ano pa po? Ano pa po ang assumptions?
And average value per claim po for the 2021, lumalabas po na, sa 2020 po kasi mga 190,000 per confinement. Dun po sa 2021, we assumed about 162,000 per claim or per confinement. And for the tests, that's an average of about, mga 3,000 po per test.
Okay, so these are the assumptions. So
Yes.
can you just submit to us so we can further scrutinize itong projections po ninyo?
Okay po.
And sige po. So what about the second requirement? It's a special provision on the management audit, Attorney Yaran. Can you give us an update on that?
Mr. Chairman, can you
Yes,
please
sir.
recognize Attorney Eli Santos?
Attorney Santos, you are recognized.
Thank you, Mr. Chair. Honorable Representative Kimbo, we will submit the result of the IC audit to this committee. Mr. Chairperson, Honorable Representative Kimbo. Thank you.
Can you give us a general situationer sa management? Kasi nga, tama po ba na last year you had a number of officials on preventive suspension, I believe 16 of them. And can you tell us kung ilan ang nag-early retirement? Can you let us know kung these top management positions have been filled if they were vacated? Ano po ang current situation?
Mr. Chairperson, Attorney Santos, if I may. Mr. Chairperson, there were, I cannot state the exact number of senior officers that were preventively suspended last year because of several cases filed against them. Most of them have already returned to work, but they were not returned to their positions as a management decision. They were given special assignments, Mr. Chairperson and Honorable Representative Kimbo. As to the exact data on this matter, we will submit our report on this, Mr. Chairperson, Honorable Representative Kimbo.
Okay, thank you. Sige po, and last question na lang po. Madam Actuary, ano po ang projections ninyo for next year? Ano ang, I suppose, it's a projected loss as well? Are you projecting another loss next year?
Mr. Chair, Madam Congresswoman, for 2022 po, depende po din siya sa magiging provision sa GAA. So sa ngayon po, kung ang
79 billion, that's what's proposed.
Opo, so kung 79 or 80 billion po ang manggagaling sa GAA, loss po siya ng 17 billion.
17 billion.
Yes po.
And what's the assumption? Is the assumption, do the assumptions include a huge amount to be spent for the consulta package?
Yes po.
How much? What is the projected spending for consulta package?
Ang target po ng corporation is about 53 billion.
Can you say that again?
53 billion po, 53.
53 billion. So you're assuming you're going to pay 500 pesos for every Filipino, more or less.
Ang current costing po natin for consulta is 500 will be paid for a government provider and 750 po for a private provider.
So what is the assumed number of beneficiaries resulting in a total payout of 53 billion?
It's about 80% po, or 80% of 111. It's about 89, I think, 89 million.
Bakit 53 billion ang sinabi mo?
Ito, 53 billion po yung payout.
Oo.
Opo.
So the 53 billion payout is more or less about 500 per head.
About
Tama?
600 po.
About 600 per head.
Yes po.
Okay. Isa na lang po. Fundamental question. Bakit kayo ang nagbabayad ng consulta package? Kasi Mr. Chair, consulta package is a check-up. So basically, they pay for a check-up for every Filipino, which is really not insurable. So arguably, dapat ang nagbabayad po niyan is DOH. Kasi hindi mo naman yan masasama sa premiums di ba? Kasi hindi siya insurable. So, wala bang comment ang Insurance Commission tungkol dito? Have they weighed in on the appropriateness of your inclusion of a 53 billion consulta package, which will result in a projected loss of 17 billion next year? Ang mangyayari niyan, every year ka na lang magkakaroon ng loss, therefore, mamamatay na ang PhilHealth in 2027. Yun po ba ang gist ng inyong actuarial projections?
Mr. Chair, Madam Congresswoman. Yes, po meron po kasing, yung po ating collection is based on sa po ano yung legislated by the law. And the benefits are also cited in the law, no? So there's a transition to comprehensive outpatient benefit, and there's a corresponding increases in benefits.
Sorry, Mr. Chair, but can you just answer my question first? Ito po bang sinabi ko na ang dahilan kung bakit sa tingin ninyo mamamatay na ang PhilHealth in 2027 is because beginning next year, you will roll out consulta package which gives check-ups to every Filipino amounting to about 600 pesos per head. And assuming that you will not get subsidies for that package, magsasara na ang PhilHealth in 2027. Tama po?
Yes, in simple terms, yes po.
Okay. Therefore, my question is, tama ba na kailangan ninyong i-shoulder ang check-ups? Because check-ups are not insurable. Eh talagang ikamamatay nyo talaga. So has the Insurance Commission, which will act as your auditor, has it weighed in on this?
Yung pong pagdating sa rollout ng konsulta, wala pong comments pa ang Insurance Commission. We can inquire po on that aspect. Pagdating naman po dun sa if this is individual-based or population-based, which is the basis for coverage ng DOH or PhilHealth, this will be discussed po by TWG committee comprised of DOH and PhilHealth to finalize po alin ang mapupunta sa PhilHealth at alin po ang shoulder ng DOH. So kung we need to discuss po yung konsulta, if it will be a population-based or individual-based benefit, it will be discussed po and decided during the TWG.
Kasi arguably, Mr. Chair, it's perhaps individual based in terms of consumption, but the benefits are for the general population. And secondly, I disagree with your interpretation of the law. Sa aking pagbasa ng Universal Healthcare Law, what is indicated is that individual-based services will be financed by prepayment mechanisms, including social health insurance, which also means that includes the GAA. Diba? So it doesn't preclude the possibility that the funding for consulta package will be lodged in the DOH budget. So that's my personal interpretation of the law. And I would like to request you to seek legal advice on that kind of interpretation. So, because I think that yan ang dahilan kung bakit mamamatay ang PhilHealth sa 2027. And this is a serious concern and we need a solution for that. So I'll end there, Mr. Chair, and we'll just await the submissions of PhilHealth. Thank you po.
Thank you, Representative Kimbo. As there are no other matters up for discussion, I'd like to commend PhilHealth for their attendance in facing the questions and concerns of the members. And I'd like to thank them again for responding to the issue at hand, which is the non-payment of or delayed payment of claims. So, is there any motion to adjourn?
Move to adjourn, Mr. Chairman.
Any second?
Second.
Before we adjourn, the resource persons are reminded to comply with the submissions of documents as required by our members and take note of our suggestions and recommendations. The meeting is now adjourned. Maraming salamat po sa inyong mga suporta at pagkakaisa sa gawain ng Kongreso. Magandang hapon po. Thank you po sa lahat.
Thank you, Chairman.
Salamat, Chair.
Salamat po.
Po.
Thank you po.
Thank you.